You are the nurse in a primary care clinic taking care of a patient with spastic bladder. Her physician prescribes oxybutynin for symptom relief. Which of the following best describes the mechanism of action of oxybutynin? A. Calcium channel blockade. B. Antagonism of M1, M2, and M3 muscarinic acetylcholine receptors. C. Direct thrombin inhibition. D. Beta adrenergic blockade. E. Alpha adrenergic blockade. The answer is B. Antagonism of M1, M2, and M3 muscarinic acetylcholine receptors. Oxybutynin reduces muscle spasms of the bladder and urinary tract. Oxybutynin is used to treat symptoms of overactive bladder, such as frequent or urgent urination, incontinence, urine leakage, and increased nighttime urination. In patients with spastic bladder, oxybutynin exhibits its anticholinergic effects most significantly on the smooth muscle of the bladder detrusor muscle, which helps to treat the patient's symptoms associated with spasm of the muscle, which often manifests as urinary frequency or urgency, with or without urinary incontinence. What is the primary effect of botulism toxin? A. Ascending paralysis. B. Nausea and vomiting. C. Tonic paralysis. D. Flaccid paralysis. The answer is D. Flaccid paralysis. Botulism is a rare and potentially fatal illness caused by a toxin produced by the bacterium Clostridium botulinum. Botulism toxin inhibits acetylcholine release from the presynaptic nerve terminal, causing flaccid paralysis. Death in botulism exposure is generally due to respiratory failure. Tonic paralysis is the cause of respiratory arrest in other toxicity exposures, such as exposure to tetanus toxin. What organism causes Rocky Mountain spotted fever? A. Rickettsia rickettsii. B. Ehrlichia chafensis. C. Rickettsia helvetica. D. Borrelia burgdorferi. The answer is A. Rickettsia rickettsii. Rickettsia rickettsii causes Rocky Mountain spotted fever, and is spread by dermacenter ticks. It causes fever, headache, muscle pain, and a rash. Doxycycline is the drug of choice for the treatment of Rocky Mountain spotted fever, including in children. The risk of dental staining in the treatment of Rocky Mountain spotted fever is very low, as dental staining is a cumulative dose effect, and treatment for Rocky Mountain spotted fever is typically 7 to 10 days. There is no vaccine against Rocky Mountain spotted fever. Prevention of infection requires careful attention to tick avoidance, including insect repellent, long clothing, and checking for ticks after any outdoor activities in endemic areas. Borrelia burgdorferi is associated with Lyme disease. Ehrlichia chafensis is associated with human monocytotropic ehrlichiosis, and Rickettsia helvetica is associated, very rarely, with meningitis. What is the most common cause of infectious diarrhea in HIV-positive patients? A. Clostridium. B. Campylobacter. C. Salmonella. D. Cryptosporidium. The answer is D. Cryptosporidium. While all of the listed organisms can cause diarrhea, Cryptosporidium, a protozoa, is the most commonly isolated organism in HIV-positive patients presenting with diarrhea. What is the most common infection preceding the development of Guillain-Barré syndrome? A. Staphylococcus aureus. B. E. coli. C. Campylobacter jejuni. D. Salmonella. The answer is C. Campylobacter jejuni. 30% of cases of Guillain-Barré are preceded by infection by Campylobacter jejuni. There is no known association between Staphylococcus aureus, Salmonella, or E. coli and Guillain-Barré syndrome. All of the following are frequently implicated in epiglottitis except A. Campylobacter jejuni. B. Staphylococcus aureus. C. Streptococcus spp. D. H. Influenza type B. The answer is A. Campylobacter jejuni. The most commonly implicated bacteria in epiglottitis are Haemophilus influenzae type B, Streptococcus species, and Staphylococcus aureus. Campylobacter jejuni is a common cause of food poisoning. Which agar would be the best choice option to identify Escherichia coli? A. Selenium-enriched media. B. EMB, eosin methylene blue. C. Nutrient agar. D. Phenethyl alcohol. The answer is B. EMB, eosin methylene blue, because it is selective and differential. Escherichia coli is a facultative, gram-negative, lactose-fermenting bacteria. EMB, eosin methylene blue, or MAC, McConkey, media is superior for isolating Escherichia coli because it is both selective and differential. Nutrient agar is neither selective nor differential. Selenium-enriched media would not help identify this bacteria because Escherichia coli does not require this supplemented media to grow. Phenethyl alcohol can be used to select for anaerobic bacteria, which is of no utility in this situation. Which of the following sexually transmitted infections is mismatched with its causative agent? A. Gonorrhea, Neisseria gonorrhea. B. Syphilis, Treponema pallidum. C. Toxic shock syndrome, Staphylococcus aureus. D. Genital warts, herpes simplex virus. The answer is D. Genital warts, herpes simplex virus. Genital warts is caused by human papillomavirus. All other sexually transmitted infection is correctly matched with its causative agent. Which of the following organisms causes fever, headache, fatigue, myalgia, and buboes? A. Borrelia burgdorferi. B. Bacillus anthracis. C. Staphylococcus aureus. D. Yersinia pestis. The answer is D. Yersinia pestis. The question stem describes bubonic plague which is caused by Yersinia pestis. Staphylococcus aureus causes skin infections, toxic shock, and food poisoning. Bacillus anthracis causes anthrax, which is similar to plague, but does not cause buboes. Borrelia burgdorferi causes Lyme disease, which presents as rash and arthralgia. E. coli, Escherichia coli, are primarily found in the colon of humans, but can also cause cystitis. Which of the following best explains why this occurs? A. E. coli are obligate robes. B. E. coli are microrophiles. C. E. coli are obligate anaerobes. D. E. coli are facultative anaerobes. The answer is D. E. coli are facultative anaerobes. The colon is anaerobic and the bladder is aerobic. This fact explains why E. coli normally lives in an anaerobic environment, but can also survive aerobically. Facultative anaerobes normally live in anaerobic conditions but can adapt to aerobic conditions. Microrophiles describes bacteria that are obligate robes, but are poisoned by high levels of oxygen and thus require specific oxygen levels to grow. 90% of all Proteus infections in human are caused by what organism? A. Proteus spinneri. B. Proteus mirabilis. C. Proteus vulgaris. D. Proteus myxoficiens. The answer is B. Proteus mirabilis. While Proteus spinneri and Proteus vulgaris do cause opportunistic infections in a small percentage of people, 90% of Proteus infections in humans are caused by Proteus mirabilis. Proteus myxoficiens is only found in insect hosts and does not infect humans. Proteus mirabilis is classified as which of the following? A. Gram-positive, anaerobic, rod-shaped. B. Gram-positive, aerobic, coccus. C. Gram-negative, anaerobic, rod-shaped. D. Gram-negative, anaerobic, coccus. The answer is A. Gram-negative, anaerobic, rod-shaped. Proteus mirabilis is a gram-negative, facultatively anaerobic, rod-shaped, bacillus, bacteria. It produces large amounts of the enzyme urease, which is able to hydrolyze urea to ammonia, causing the distinctively high pH seen in the urine of individuals with a Proteus mirabilis infection. Which of the following bacteria is gram-positive cocci that is found in clusters? A. Staphylococcus aureus. B. E. coli. C. Streptococcus pyogenes. D. Pseudomonas. The answer is A. Staphylococcus aureus. Bacteria are classified as either gram-positive or gram-negative. Gram-positive bacteria stain purple because of their thick peptidoglycan cell wall. Staph and strep groups are both gram-positive. Bacteria can then be organized based on their shape. Cocci are circular while bacilli are rectangular in shape. Staph grows in clusters. If a colony of round or oval-shaped bacteria are arranged in a random grape-like cluster, they must be A. Streptococci. B. Spirochetes. C. Streptobacilli. D. Staphylococci. E. There is no way to predict based on the information provided. The answer is D. Staphylococci. The two most common bacterial arrangements are staph and strep. Staph is a non-symmetrical arrangement like a cluster of grapes. Strep indicates a chain of bacteria. The three most common bacterial shapes are listed below. Coccus, round or oval. Bacillus, rectangular or rod-shaped. Spirula, spirochete spiral. Which of the following correctly describes the classification of Bordetella pertussis? A. Gram-negative aerobic rod. B. Gram-negative anaerobic cocci. C. Gram-positive aerobic cocci. D. Gram-positive anaerobic rod. The answer is A. Gram-negative aerobic rod. Bordetella pertussis is a gram-negative, rod-shaped aerobe. It requires oxygen to function and commonly infects the respiratory tract of young children, causing whooping cough. Which of the following describes the classification of NCLEX gonorrhoeae? A. Gram-positive rod. B. Gram-negative diplococcus. C. Gram-negative rod. D. Gram-positive diplococcus. The answer is B. Gram-negative diplococcus. NCLEX gonorrhoeae is a gram-negative coccus bacterium that generally presents as a diplococcus, in pairs of cocci. Vibrio cholerae is classified as what type of bacteria? A. Gram-positive facultative rods. B. Gram-negative cocci. C. Gram-negative facultative rods. D. Gram-positive cocci. The answer is C. Gram-negative facultative rods. Vibrio cholerae is classified as gram-negative facultative rods. This bacteria is the most well-known amongst the Vibrio species as it's the cause of cholera, which produces a toxin that causes very severe diarrhea. Any species of bacteria that feeds on dead matter is termed a dash. A. Halophile. B. Saprophyte. C. Archaebacteria. D. Thermophile. The answer is B. Saprophyte. Bacteria or any other microbes that feed on dead matter are termed saprophytes. Thermophilic microbes thrive in heated environments. Halophiles such as Vibrio parahemolyticus prefer salt water, and Archaebacteria are a group of bacteria found in high heat, high salt content locations such as sewage treatment plants and are able to tolerate many extreme habitats. E. coli is classified as what type of bacteria? A. Gram-positive rod. B. Gram-negative rod. C. Gram-negative cocci. D. Gram-positive cocci. The answer is B. Gram-negative rod. E. coli is a gram-negative rod. It's a lactose-fermenting bacteria commonly implicated in urinary tract infections and less frequently in gastroenteritis. Which of the following describes the morphology and features of Staphylococcus species? A. Gram-positive cocci, catalase positive. B. Gram-negative rods, catalase negative. C. Gram-positive rods, catalase negative. D. Gram-negative cocci, catalase positive. The answer is A. Gram-positive cocci, catalase positive. Staphylococcus species are gram-positive, catalase positive cocci. The most famous member of this bacterial species, Staphylococcus aureus, is commonly implicated in skin infections, upper respiratory infections, and gastroenteritis, food poisoning. Which of the following bacteria is classified as gram-positive cocci? A. Chlamydia trachomatis. B. Rickettsia browski. C. Nsriamenitis. D. Staphylococcus aureus. The answer is D. Staphylococcus aureus. Staphylococcus aureus are gram-positive cocci. Chlamydia trachomatis and Rickettsia browski are both classified as gram-negative rods and Nsriamenitis are gram-negative cocci. All of the following are gram-positive bacteria except dash. A. Staphylococcus. B. Streptococcus. C. Salmonella. D. Clostridium. The answer is C. Salmonella. All of the bacteria listed are gram-positive except Salmonella, which is a gram-negative facultative rod. A sputum culture from a patient is described as gram-positive cocci. What is the significance of the gram stain? A. The bacteria has no peptidoglycan cell wall. B. The bacteria has a thick chitin cell wall. C. The bacteria has no chitin cell wall. D. The bacteria has a thick peptidoglycan cell wall. E. The bacteria is actively multiplying. The answer is D. The bacteria has a thick peptidoglycan cell wall. The gram stain is a test used to help classify bacteria based on the presence of peptidoglycan in the cell wall. Bacteria with a thick peptidoglycan cell wall will stain dark purple, and are termed gram-positive. On the other hand, if there is no peptidoglycan cell wall, or a very thin one, it will show up as pink. This is termed gram-negative. This distinction is particularly important when prescribing classes of antibiotics, as the cell wall is commonly targeted by antibiotics. Which of the following patients are most at risk for contracting a nosocomial infection? A. A 75-year-old woman receiving chemotherapy for colon cancer. B. A 10-year-old patient admitted for abdominal pain. C. A 60-year-old admitted with pancreatitis. D. A 22-year-old mother in her third trimester. E. A 55-year-old man with an asthma exacerbation. The answer is A. A 75-year-old woman receiving chemotherapy for colon cancer. A nosocomial infection is an infection that is transmitted from one person to another inside the hospital or other healthcare facility. It is often a result of healthcare workers failing to perform adequate hand hygiene and standard precautions. Those most at risk for infection are those who are immunocompromised, chemotherapy patients, those with breaks in skin integrity, wounds, and those with invasive devices, PICC lines, urinary catheters, invasive monitoring. Which of the following regarding pathogenic bacteria is false? A. Some bacteria have cell walls. B. Pathogenic bacteria may reproduce inside a host or human's own cells. C. Pathogenic bacteria may secrete toxins that make the host ill. D. Pathogenic bacteria contain a protein envelope called a capsid. E. Many bacteria do not have flagella. The answer is D. Pathogenic bacteria contain a protein envelope called a capsid. A pathogenic bacteria is a disease-causing bacteria. They may secrete toxins to make a host ill or reproduce inside the host's own cells. Bacteria may have cell walls, although some do not. Similarly, some bacteria may have flagella and others do not. It is typical for viruses to have a capsid, protein coat. Some viruses such as the human immunodeficiency virus, HIV, have envelopes, which makes it difficult for the immune system to detect and destroy them.